welcome to my channel. If you're new, welcome. So happy to have you here. If you are returning, welcome back. In this video, I'm going to talk about Novavax and Covaxin, and I will also add another bonus vaccine that I believe is really effective, but it goes somehow under the radar. So I'm going to talk about that as well. So stay tuned all the way until the end of this video. So I hope you have watched the ACE2 receptor video where I explained the ACE2 receptor, where is it located in our body, in which organs, naturally, what is the function of the ACE2 receptor in our body naturally, what has this to do with SARS-CoV-2, with COVID-19, as well as with the vaccines and wearing a mask. So please watch that first. So in that video, I also mentioned the vaccine groups that we have so far. So we have one group that is mRNA based, which comes from Pfizer, BioNTech, as well as from Moderna. The other group is adenovirus based. Those are coming from AstraZeneca and Johnson & Johnson. Then we have the first protein-based vaccine coming from Novavax, as well as we have inactivated viruses coming from Covaxin and Sinovac. And also we have now all others are being developed too. We have Medicago, we have others. We are not going to talk about that in this video. If you want me to, please write it down in the comment box and I will see if I have time to develop all these videos, or if you have any questions, let me know. I maybe answer them very quickly in the comments, okay? So the messenger RNA, the adenovirus, as well as the Novavax vaccines are all based on the spike protein only. And Covaxin as well as Sinovac is based on the inactivated form of the virus, of the SARS-CoV-2 virus. I'm going to talk about that later, what the difference between those two are. There's also a little bit of difference there. Novavax, as I said, is the first protein-based COVID-19 vaccine. What does that mean? While the messenger RNA and the adenovirus-based COVID-19 vaccines are producing inside our body the spike protein, the Novavax strategy is to produce the spike protein outside the body and then put the spike protein into our body, and then to boost the immune response inside of the body that way. That's the difference. So these two RNA and adenovirus based vaccines, when they go inside the body, they produce the spike protein inside the body. Novavax, however, has the protein developed, produced outside, and only the protein, the spike protein, will be introduced into our body. How do they do that? First, they took the sequence of the SARS-CoV, of the very first strain of the SARS-CoV-2, and then created this beta-baculovirus in order to infect moth cells, insect cells. The reason why they do that, and this is very critical in biotechnology, is because with moth cells, with insect cells, and it's not really that we heard this brand new. I mean, I heard it back by PhD time. It was like so many years ago. So it is really not something like, whoa, but it's like the use of it, to actually use of it. It's very fascinating. I love it. At the same time, what it does is that it produces large amount of proteins in these insect cells rapidly, and that's the nice technology about it. Instead of using mammal cells and just have them produce all these proteins, the insect cells, because they divide so quickly, they are able to produce these proteins much faster, and that's absolutely critical, especially in vaccine development, especially in the pandemic. So once they have the insect cells produce the protein, this means that they were literally being produced by an insect cell. This means with everything, with all the folding, the natural fold, because protein folding is absolutely critical. The correct folding, the 3D folding of a protein is absolutely critical for the protein to function properly. And because it is produced by insect cells, the 3D folding of the protein is in a natural shape, in a natural folding, and therefore we have confidence that these spike proteins are as natural as they can possibly be. So once they have these proteins using their nanoparticles, and in this case, unfortunately, I know many people were waiting for Novavax because they have polysorbate or polyethylene glycol or PEG allergies. Messenger RNA technology is using as nanoparticles PEG or polyethylene glycol, and the adenovirus technology is using polysorbate as a nanoparticle. And in this case, polysorbate is polysorbate 80 and PEG is PEG 2000, what they're using. So the reason why I'm saying that, this means the molecular weight. These nanoparticles have different molecular weight, and the different molecular weight, so the numbers are different, and each molecular weight can cause different types of allergic reactions if you have allergies against PEG or polysorbate. So the PEG 2000 is a pretty high, that's why it can cause a severe amount of allergies because of the molecular weight. Because PEG is in everything, pretty much everything what we are using, in creams and everything, even in food, but the molecular weight are much lower or much different. Novavax unfortunately uses nanoparticle polysorbate 80 as well. So if you're allergic to polysorbate, then Novavax may not be good for you, so check with your doctor. With the nanoparticle polysorbate 80, it introduces into the body, together with their very special Matrix M adjuvant, a saponin-based adjuvant. This comes from a tree, and as the clinical data shows, it causes a good amount of immune boost and the antigen presenting cells towards the injection sites, but also into the local lymph nodes, and create an immune response, but does not look like it creates a severe allergic reaction. The saponin does apparently not create allergic reaction. However, as I said, if you are allergic to polysorbate as well, especially polysorbate 80, please check with your allergist or with your doctor and see whether or not it is good for you. Oftentimes, allergic reactions can be treated in the hospital with certain medications. Of course, if you have anaphylactic shock, that can be treated too, so you may need to get this vaccine under medical supervision. And then once it enters into the body, as I said, the spike protein, as I mentioned in the previous ACE2 receptor video, it creates a neutralizing antibody against the SARS-CoV-2. The data shows the efficacy of Novavax's protein-based vaccine to be 90+. But I also would like to add the information about the boosters and the Omicron. So the data of Novavax showed that with the second and especially with the third boosters, the immune response against Omicron was increased up to 9.3-fold. They also looked at Delta, so both Delta and Omicron immune response against Omicron and Delta were both increased after the third dose of the Novavax vaccine. Novavax doses are 5 micrograms of recombinant spike protein plus 50 micrograms of Matrix M adjuvant. So the recommendation is generally a 2-dose vaccination series in persons of 18 and older. An additional 3rd dose is administered to immunocompromised individuals. But they also suggest that with the 3rd dose in everybody, the immune response of IgG-based immune response has a 9.3-fold increase, and the ACE inhibition is increased 19.9-fold with the 3rd booster dose. So Novavax is a 2-dose vaccine. However, most likely the 3rd will also need to be given at this point because of the surge in Omicron as well as the Delta variant. So these 3rd boosters help dramatically to increase the immune response against Delta as well as Omicron. So let's talk about the side effects of the Novavax vaccine. The US NIH reported that generally the Novavax vaccine is well tolerated. Mild to moderate injection site pain, tenderness, and these were the most common side effects, which is absolutely normal. They also reported fatigue, headache, and muscle pain lasting less than 2 days. And these were all, again, common symptoms. Events of anaphylaxis has been also reported with Novavax. And I will also like to add the pediatric data from Novavax because it was just announced, and also Novavax has submitted its pediatric use authorization or data to the FDA. So let me tell you quickly about that. So overall, the IgG and wild-type neutralization responses were higher than observed in adults. This is the pediatric data. The IgG and also the ACE2 inhibition against variants also were higher than it were in adults. The adolescents' neutralization responses were 1.5 times higher than in adults. The efficacy against the symptomatic Delta variant infection was 82%. Overall efficacy was 79.5%. And these findings, the age group that Novavax has submitted to the FDA was between 12 and 15 years old and 15 to 18 years old. So 2 data groups. Let's now talk about Covaxin. So Covaxin is developed with the US taxpayers' dollars, that's correct, by the Bharat Biotech in India. This vaccine, Covaxin, is based on the inactivated virus of SARS-CoV-2. What does that mean? In this case, and I will talk about another vaccine, also inactivated virus, but in this case, for Covaxin's case, they took the virus from an asymptomatic patient, COVID-19 patient, but asymptomatic, and inactivated them in the lab so that they block the genes in order to inhibit the virus's ability to produce more viruses, to expand and to grow. So basically, like we said in the ACE2 receptor video, even if the virus would be entering into, because it has the spike-like protein on the surface, enter into the cell, it will not be able to create other viruses inside, because the ability to produce other viruses or develop other viruses or expand into many other viruses is inhibited because the gene that causes the expansion of the virus is inhibited in the lab. The inactive virus is being injected into the muscle. The immune response is being provided that way. On April 21, 2021, mid last year, they showed the efficacy against severe COVID-19 was 100%, which I am not surprised. Of course, this impacted because of the 100% of severe disease was reduced by this vaccine. The hospitalization obviously is also be reduced that way. But it also added that the efficacy against the asymptomatic COVID-19 infection was 70%. This shows that the transmission is also reduced by this vaccine, which I'm also not surprised. And they looked into the memory cells. Memory cells were persistent up to 6 months. This is also what I'm not surprised about. In January 21, 2022, India has now given Covaxin a full authorization. Now, when they would go to the doctor's office, they would be able to get regularly this vaccine. Let's talk about the variants. So how is it affected against the variants? And by the way, when we talk about Omicron has currently more than 30 mutations compared to the original strain of the SARS-CoV-2. 30 mutations. That's wild. Now let's go back into the efficacy against the variants. And here, what we see is that Ocugen company, Bharat Biotech, as well as Emory University in Georgia, they have done a phase 1 and 2 clinical trial and announced in January 12, 2022, that this vaccine was able to produce neutralizing antibodies against SARS-CoV-2's variants that are alpha, the first strain, beta, delta, zeta, and kappa. Obviously, we all know, and everyone who is following Covaxin is also aware that India has done a large study for children and adolescents, that the data show that years of 2 to 18, they had neutralizing antibodies up to 90%. And the titers were observed against S1, RBD, and proteins, as well as the wild type neutralizing antibodies. It is also suggested that if you are breastfeeding or pregnant, not to get this vaccine because it was not studied. But for the children's group, for the children and adolescents, and which by the way was approved in India, but Ocugen company has submitted the US FDA EUA for pediatric use in November 5th, 2021. So let's talk about the side effects. The phase 2 double-blinded randomized Covaxin trial demonstrated long-term safety with no serious adverse events as of January 8, 2022. The side effects that was only reported are just what we generally know from all the vaccines are pain in the injection site, swelling, redness, itching, headache, fever, malaise, body ache, nausea, vomiting, rashes. It is also suggested that severe allergic reactions are not expected with Covaxin. However, it may occur, of course, everybody is different. So you will need to also, if you have this type of history of getting allergic reaction to any vaccine, you will also need to talk with your medical doctors. Maybe you get this vaccine under supervision. What I also now add to the Covaxin and the Novavax is Sinovac. Sinovac is going for some reason under the radar, although it is the highest amount of vaccine used to date. 1 billion doses of Sinovac was injected into people's body around the globe. 1 billion to date. And also 110 million children under age of 18 have received Sinovac vaccine as of October 21st, 2021. 110 million children and adolescents in China have received Sinovac. 1 billion doses of Sinovac was given all over the globe to date. So that's incredible. I personally also know from people that I know have received Sinovac very in the beginning of the vaccine development. Sinovac was the first produced a large amount of vaccines and spread it throughout many countries, especially into Asian countries, but also in some European countries like Turkey and also in the South American countries. So Sinovac is a company that has produced Coronavac. So when I say Sinovac, is actually the company's name is Sinovac, but the vaccine is called Coronavac. So Coronavac by Sinovac, and I did make a video about that in my channel last year, in early times of last year, I think it was the beginning of 2021, because I was so fascinated about that vaccine. So that vaccine is also an inactivated version of the SARS-CoV-2. The difference between Covaxin and Sinovac is that Covaxin's virus was taken from an asymptomatic patient. The Sinovac's Coronavac inactive virus was developed in the lab. It is a full virus, so the cells were infected and the viruses were produced and then were inactivated also in the lab. So the virus from a patient in Covaxin was inactivated in the lab, but it was originally from a patient. But the Sinovac's Coronavac was developed, the full virus was developed and produced in the lab. It was also inactivated in the lab. So I know many people who have gotten this, the first and second dose of Sinovac, when later all these countries or many of the countries switched to the mRNA vaccine and the third and the fourth doses. But this vaccine, there were so many studies which I have also followed last year, was to study the first and second dose of Sinovac, and then while Pfizer then was almost finished in production, then there was like a spread of the mRNA by Pfizer and Moderna, and so they did a study based on what about when we use the first and the second Sinovac, so Coronavac vaccine, and then do the third or maybe the fourth with Pfizer's mRNA vaccine. So there was a study that what the study showed was the higher SARS-CoV-2 specific binding and neutralizing antibodies was higher when they had a third dose after the Sinovac vaccine with Pfizer's mRNA vaccine. However, the CD4 positive and the CD8 positive T cell responses to the structural protein of the virus, structural protein, why? Because it's a complete inactive virus. So it has the complex, like in Novavax, the natural protein structure. So the CD4 positive and the CD8 positive T cell responses to the structural protein was higher in Sinovac's Coronavac vaccine. So that is incredible, and I personally, very in the beginning, really liked Sinovac. It is obviously sad that we don't have it here in the US, but for all other countries, if you have access to Sinovac, Sinovac is a great vaccine. So let's talk about the efficacy of Sinovac. And by the way, Sinovac company was the first who got approval for its H1N1 influenza virus. So it's a company that knows what it's doing. So they're actually developing very effective vaccines. Let's talk about their efficacy. And as of December 16, 2021, a few months ago, the third booster with Sinovac's Coronavac has the efficacy against Omicron for 94%. That's incredibly high. So that was all. I hope this was helpful to you. I hope I was able to shed a little bit of light to the difference between Novavax COVID-19 vaccine, Covaxin's COVID-19 vaccine, as well as Sinovac's Coronavac vaccine, and the difference between Covaxin and Sinovac's Coronavac vaccine, which both are the inactive version of the SARS-CoV-2 virus, which are absolutely critical, in my opinion, to approve these three vaccines, Novavax, Covaxin, and if you're in the country that has Sinovac's Coronavac vaccine. So all these are critical to end the pandemic, especially in order to block the further mutations, as well as to really end the pandemic and end further outbreaks. In my opinion, inactive virus-based vaccines are absolutely critical. In this case, it is Covaxin and Sinovac's Coronavac vaccine. So I hope this was helpful to you. Thanks for watching. It was critical for me to explain to you what are the differences, because I believe that it was not really explained out there. So I hope this was helpful. Based on this information, what are your thoughts about either of all of these vaccines? Please let me know in the comments. Let me also know in the comments if you have any questions. From you guys, I hear so many incredible questions. So let me know in the comments any questions that you have. I might answer them quickly if I can. If I see there's something more in-depth questions, I will look more deeper into that, and maybe I create another video. Don't forget to watch the ACE2 receptor video as well. That's actually absolutely critical. Watch that first, and hopefully you came from that video to this video. But if you didn't, go back and watch that video please as well, and share that video as well. I hope you liked this video. If you did, please give me a big like and share this video with so many more people so that everybody can understand the basics of it. Also, subscribe to my YouTube channel and hit the bell icon so that you can notified when I upload the next video. And until the next video, take care. Bye bye.